Good day, everyone. Have you ever just tried to get something done and just couldn't seem to get it done? Like over and over, you try and something just keeps blocking you? Well, my motivation to you is to continue to try and don't give up. Continue to try and don't give up. So, me with this video yesterday, I tried 2 or 3 times and I did stop and gave up for a little bit because I just had other things to do. And I had spent so much time trying to get this out. And finally, today, hopefully, it is playing appropriately. I don't know what was happening yesterday, but we need to look at that case event. So, if you remember, if you saw and reviewed the question from yesterday, we had a pediatric client with constipation. They're brought to the clinic for concerns about constipation. So, this is a 3-year-old, and this is a bow tie question. And we went through the potential conditions: celiac disease, colitis, or functional constipation. And we went through a few signs and symptoms of each and possible treatments. So, in conclusion, go with what you know. Even if you're not sure of what that encopresis is, then go with what you know. We know that they're coming in with constipation. So, we're choosing functional constipation. There was other signs and symptoms in the nurse's notes and vital signs that led us to think constipation. Straining and cries during a bowel movement. Stools are quite large. Avoids going to the bathroom. Hypoactive bowel sounds. Mass palpated in lower left quadrant. Stool noted in rectal vault. His vital signs were pretty good. There's no fever. So we did not think this was an infectious process. So once you choose the condition that the patient is most likely experiencing, the next thing that you want to do is think about your actions to take. Your actions to take are going to lead you to the correct parameters to monitor. So it's all based and focused on your subject. What do you think is wrong with them? Constipation, functional constipation. The term functional just means that they're able to go, or they do go at certain periods and points, but it's very infrequent. And when they do go, it is painful. It's difficult to go. And that's why a lot of times the child will avoid going to the bathroom. So we know for functional constipation, it is common in young children, characterized by infrequent bowel movements. The stool is painful. It's painful and hard to go, and they're going to withhold trying to go to the bathroom. Now, once we read through a little bit about constipation, when it is severe, encopresis develops. So those are things I would put in my notes once we complete the question and we go back and look at rationales. Even if I did not know what that term is, I'm also showing you how to focus in on what you do know to get to the correct answer. So in this case study, he did have a history of encopresis 6 months prior. All right, now there's certain things that can trigger functional constipation. This is a 3-year-old, so he's a preschooler. It can be triggered by entry into school. It's a new environment, a little bit of stress on the child. Toilet training can also trigger it, as well as dietary transitioning from infant to more solid foods. So during the dietary transition of an infant. So, treatment is going to include what we generally think of for most cases of constipation. It's increasing the dietary fiber and possibly giving them something to soften their stool and help them to alleviate that and help them go. So, for most all cases of constipation, and what NCLEX likes, they like you to increase dietary fiber. It's a more natural way to help a person regulate their bowel. And I would like to have had the choice of increase fluid, increase water intake if it's not contraindicated. They don't give us that option here, but keep in mind NCLEX likes increased fiber and increased fluid if it's safe to do so. There are going to be cases where we don't want to overload the patient, or where they have some other GI problem and dietary fiber may not be a good choice. But in this case, that should be good. We do want to help this child eliminate his stool, so we are going to administer an osmotic laxative. I would not prepare for this barium swallow, barium enema. There is such a thing as a barium swallow study. It's a diagnostic procedure, a diagnostic process. Is where they have the person either ingest the barium. In this case, they'll probably give the barium through an enema and see how it flows and see if there's any blockages. But we don't need that in this case. So it's not used to diagnose functional constipation. So we can eliminate that. Also, we don't suspect that this patient has an infection, and we don't foresee that he's going to develop an infection. So it does not seem that we need to administer prophylactic antibiotics. Also, with constipation, as long as there's not an obstruction or an ileus, we feel that it's safe to allow him to continue eating and drinking as normal. Just increase that dietary fiber, give him something to soften his stool or help him to go, but we don't have to keep him NPO. Now, you may be saying, well, what is an osmotic laxative? Any thoughts on what is an osmotic laxative? Well, these are medications that are commonly used to treat or prevent constipation. And the way they work is they draw extra water into the stool, making it softer to pass and easier to pass. These osmotic laxatives pretty much are available over the counter, sometimes by prescription. Some good examples that you may be familiar with are milk of magnesia, lactulose, polyethylene glycol, which is Miralax. So different types of laxatives like that are commonly used for constipation. All right, so now our actions to take should lead us to the parameters to monitor. So we basically just want this child to go. We're going to give him that fiber. We're going to give him the laxative. So it's more obvious that we should monitor his stool pattern and monitor his perianal area. Remember, in the nurse's notes, what they had assessed was that there was stool noted in the rectal vault, and the anal tone was noted to be open and distended. Open and distended. So in this case, we don't need to monitor electrolytes. We don't see that he's vomiting or having diarrhea, so he's not going to be losing that or volume. He should not become dehydrated. We do want to make sure he's well hydrated, but white blood cell count shouldn't be an issue. Doesn't seem like there's a risk for infection here or a risk for bleeding or hemoglobin, a drop in hemoglobin or anything. So that should not need to be monitored with functional constipation. It doesn't necessarily directly affect those parameters. But the parameters we would monitor is the stool pattern and monitor the perianal area for trauma. All right, did you get that question correct? That wasn't too bad. That was the bow tie. So you should have 5 options total selected worth 5 points. We talked a little bit about vital signs for the toddler yesterday or in our previous video. So I'm going to go kind of back and then forward here. So in your notes, you should have what is functional constipation. You should have what this encoparesis is and that it could develop in cases of severe constipation. And as a reminder, it is encopresis is constipation with fecal incontinence. It's when they may go unexpectedly. Children often complain that soiling is involuntary. They can't help it. It just comes out and it occurs without warning. So if the child does not have a neurological or an anatomical disorder, then encopresis is usually the result of fecal impaction and an enlarged rectum caused by chronic constipation. You should have things, what causes this functional constipation, what can lead to it and trigger it. You should have in your notes treatments for it. And when should we use a barium enema, and that it is not used for diagnostic for functional constipation. You should also have that we don't use prophylactic antibiotics. We don't have to keep this patient NPO. We talked a little bit about celiac disease and how it is characterized by loose, foul, smelly, greasy stool, nausea, vomiting, chronic diarrhea. This patient did not have any of those symptoms. And we reasoned out Hirschsprung disease because it is characterized, although it is characterized by constipation, that was the one part of it that was true, but encopresis is uncommon. Now, if we didn't know that term and didn't know whether or not that would help reason out Hirschsprung, think about the other common way that they will describe their stool problem. They can have constipation, but they'll also describe their stool that it's small and ribbon like. The patient may have failure to thrive. Defecation should not be painful like it was with this child, and there is rarely stool in the rectal vault like with this child. Also, in Hirschsprung's disease, the anal tone is tight, and in this patient, the anal tone was pretty open. Also, with colitis, there is usually not constipation, but diarrhea, and it's usually bloody. These patients can have weight loss, abdominal cramping, and fatigue. We talked about our parameters to monitor in functional constipation and why it was not necessary to monitor the electrolytes or white blood cell count, um, or the hemoglobin. All right, so I hope you got that correct. We'll go back to our answers so you can just double check. Hopefully you got that one correct. Was not too bad, not too bad. Those are some of my favorites. All right, so it is Fun Fact Friday. So every Friday, I like for you to learn a fun fact about the world of nursing or about NCLEX. So today, we did talk about the previous case study. So go and watch that previous video to get you up to speed with a little more of where to search those other conditions in Saunders. And now we have our answers for this case study. So also, let's talk a little bit about a fun fact that you should consider. Maybe after you become a nurse or just for nursing. So let's look at this. This is a fun fact that I thought was interesting. I receive emails. I'm subscribed to the NCSBN. So good morning, members. They told us, I think this was a few days ago. This was back on April 3rd. So it was interesting. They put this article in here that nurses' ability to detect pediatric respiratory distress is aided by virtual reality training. Now, when I clicked on that, it took me to this article, which is from Health Day, News for Healthier Living. And it featured this article. Now, this article comes out of the American Association of Critical Care Nurses, actually their journal. And I am a member as well as certified as a critical care nurse and subscribe to their journals and publications. So they focused on the benefits that were seen for recognizing impending respiratory failure and altered mental status in these new nurses who were trained virtually. This is very interesting, very high dynamic, high impact news. And I feel like where the world is moving towards more virtual style of learning, this is very interesting. When I had students that were talking about they had to do their sim lab, that they couldn't go to clinical, and how we have somewhat adjusted to this way of learning, it has shown in this research that they did that those nurses who were trained virtually through a virtual reality based training curriculum, they had an increase in their identification skills, their assessment skills, than those who were trained the usual orientation curriculum or the traditional way. So, researchers found that nurses in the intervention group who actually did the virtual reality curriculum were significantly more likely to correctly recognize impending respiratory failure at both 3 months of age and 6 months. These groups were also able to recognize altered mental status at 3 months and six months. So this is very, very interesting. It's kind of record-breaking research, I think, to just see that we are adapting to virtual reality. And so, in conclusion, virtual reality may offer a new approach to nurse orientation to enhance training in pediatric specific assessment skills. So I don't know if this is just beneficial for pediatrics or if other studies have been done for adult nursing, but I think it is a breakthrough that may cross over to other specialties of nursing. This is the actual article. This is how the actual journal looks. In the publication, it's the AJCC, the American Journal of Critical Care, Impact of Virtual Reality Simulation on New Nurses' Assessment of Pediatric Respiratory Distress. And the research was actually done at a Cincinnati hospital. So if we go back here, they mention it's from a Cincinnati Children's Hospital Medical Center and colleagues that they did this assessment whether the virtual reality, um, whether that would improve the new nurses' recognition of these symptoms in pediatric patients, respiratory distress and impending respiratory failure. So I actually have this journal article. This is my login for the American Association of Critical Care Nurses, but I can go to education and publications. They also send me the actual real life article, but here is, or the journal. And so the journal for the current, this was the March issue of the journal, and it does look like this. So I thought this was just, I almost want to say astronomical, but it's very, very interesting. It's on the front page there, simulation training to assess respiratory distress in children. So that is our fun fact for today. I hope you are enjoying the beautiful Friday. We're having a beautiful Friday here. I hope you're enjoying the day, enjoying the afternoon, and getting some productive study time in. If you would like to join a webinar, we are going to meet Saturday at our usual time. I was trying to wean that Saturday out this week, but it seemed to be in the favor of everyone. So we're going to meet Saturday, which is April the 6th at 8 p.m. And anyone and everyone's welcome to join. All you have to do is go to the link and do the poll, and I will be able to collect your email and send you information on how the Zoom link of how to join. It's going to be tomorrow, and in that discussion we're going to be celebrating a couple nurses who did pass the NCLEX, and we're also going to just talk a little bit about a few tips, but we'll probably get a lot of tips from them on what they did to pass the NCLEX. And you may be able to see how a tutor as myself or an NCLEX course may assist you in passing the NCLEX exam and becoming a LPN or an RN. So I hope this study has helped you today. I will see you next time.